When the world feels shaky, whether from climate disaster, political turmoil, or just everyday accidents, one of the most powerful things you can do for yourself and your community is learn basic medical skills. You don't need to be a doctor to save a life. You just need to know a few essential techniques, stay calm under pressure, and be willing to step up. So here are some life-saving basics that every beginning prepper should know. Cardiac arrest can happen anywhere at any time, and immediate CPR can double or triple someone's chance of survival. In order to perform CPR, you must first check responsiveness and breathing. Tap the person and shout. If there's no response and no normal breathing, call 911. Push hard and fast by placing the heel of your hand in the center of the chest and stack your other hand on top. Compress about 2 inches deep. The rhythm should be about 100 to 120 beats per minute, or like in the song, Staying Alive. Also perform rescue breaths. After 30 compressions, tilt the head back, lift the chin, and give 2 breaths that make the chest rise. Repeat this process until help arrives. Choking can be quick and silent, and it can kill in minutes if no one acts. In order to perform the Heimlich maneuver, you must first stand behind the person, wrap your arms around their waist. Make a fist and place it just above the navel. Grab your fist with your other hand and thrust upward sharply. Repeat until the object is expelled or the person becomes unconscious. If they become unconscious, begin CPR. For infants under 1, you must support the head and body, give 5 back blows between shoulder blades, and then flip the baby face up and give 5 gentle chest thrusts using 2 fingers just below the nipple line. And alternate this until the object is out or help arrives. Severe bleeding can be fatal in minutes, and quick action matters. In order to stop bleeding, you must apply direct pressure with a clean cloth, bandage, or your hand. Do not remove soaked bandages. Add more layers on top. Elevate the wound if possible, or use a tourniquet if the bleeding is life-threatening and won't stop. Place it above the wound and tighten until bleeding stops and help arrives. When shock happens, the body isn't getting enough blood flow, and this often occurs after trauma. Some of the signs include pale, clammy skin, a fast or weak pulse, rapid breathing, and confusion. Lay the person flat on their back and elevate the legs unless broken. Keep them warm with a blanket. Do not give them food or drink, and get medical help immediately. There are several different types of burns, including first degree, which might be red and minor, which you can cool with water and cover with a clean cloth. Second degree burns, which include blisters. You must cool gently, do not pop the blisters, and cover loosely. And the worst, third degree burns, which can include charred or white skin. Do not immerse in water. Cover with a sterile dressing and get emergency help. If a person has a broken bone or a sprain, it's important that you immobilize the area, but don't try to realign it. You can splint with what you have using sticks or boards or cardboard. Put padding around the injury. Secure above and below the joint. And if ice is available, use for sprains, but don't put it directly on the skin. For everyday basic wound care, make sure you always wash your hands first. Clean the wound with clean water, apply antibiotic ointment if it's available, and cover with a sterile bandage. Watch for signs of infection such as redness, swelling, or pus. If you suspect infection and you have no access to a medical facility, you must clean the wound thoroughly with clean hands and using the cleanest water available. Try to disinfect with any items such as alcohol or hydrogen peroxide if available. Dress the wound properly and change the dressings often. Keep the wound slightly moist, and this encourages healing and prevents cracking. Support the person's immune system by encouraging them to stay hydrated and watch for signs of a worsening infection. If you suspect someone might be having a stroke or a heart attack, think of the acronym FAST: face drooping, arm weakness, speech difficulty, and time to call emergency services. Heart attacks include symptoms like chest pain, pressure or pain in the arm or jaw or back, nausea, sweating, shortness of breath. Strokes and heart attacks require prompt emergency intervention. If you suspect a person is having these problems, try to get them to a medical facility as quickly as possible. Another thing you can do is to build a good first aid kit. You don't need a whole hospital in a bag, but a few basics go a long way. Things that you should include in your first aid kit might be assorted bandages and gauze, medical tape and scissors, antiseptic wipes and alcohol pads, gloves, a tourniquet, pain relievers such as ibuprofen or acetaminophen, antihistamines for allergic reactions, tweezers, and an emergency blanket. In a true emergency, knowing these basics can mean the difference between life and death for you, your family, or your community. Prepping isn't just about food storage and gear, it's about resilience, and nothing builds resilience like the ability to keep someone alive until help arrives. So practice these skills, take a first aid course, and share what you learn with your community, because survival isn't individual, it's collective. Thanks for watching.